So I'm going to go to Sudan. And as I said, we have made a lot of small changes to the program because Sudan is a war zone. I'm sure you all know what is going on in Sudan. It's a country under war now. And we are very delighted, very, very delighted. I'm very pleased to welcome a Sudanese doctor, a consultant, a pediatrician. I don't know her. Jenny doesn't know her. All of the organizing team didn't know her, but we heard about her the same like any other person from the media. The story we heard about Dr. Fathia Elmakki, which you're going to hear to join us shortly, this lady or this woman or this doctor did not leave the country like millions did. That doesn't mean there was nothing wrong for those to flee the country under war, but she didn't. She stayed put in Sudan. She continued to provide her expertise and saving lives in a war zone in Khartoum, where is the real killing, raping, massacres all happen in Khartoum. Not all in Khartoum, but this was the top place where the trouble, it was everyone left the country. Not everyone, but the majority of people left. This lady, fantastic lady, stood there and she continued to do her work. And what's more inspiring about her when we watched the videos and we did our best, and I'm really grateful for all those who helped us to connect with Dr. Fathia because we didn't know her, like Dr. Ishraha from Canada. She helped us to connect with her. And luckily enough, we managed to speak to her. What inspired many people who those at least can understand the Arabic language when you see the videos, the way she managed to bring the team around her, the doctors, the students, everyone in the hospital. She was a leader. In my opinion, people, they see her as a doctor, stood like many other doctors, saving lives in Sudan. But for me, and I think many others, they will see it from a different angle. She was a real leader at the time of war, at the time of need. If you see the people talking about her, what she has done, it's not about how she was saving the lives of these children, but it's about how she managed to glue them together, to bring them together. And that reminds me, Dr. Fathia, with Professor Lainetti Louis in South Africa, in Port Elizabeth, I can't remember, 2004. I can't remember when I was in South Africa. They said to me something about Nelson Mandela. And she said to me, and I think there's another professor, they said to me, Nelson Mandela, we have someone from South Africa. Alina is from South Africa. She could confirm that when she come and speak to us. They said to me, one of the quality of Nelson Mandela, Alam, there's a lot of things you can hear about Nelson Mandela. But they said to me, Alam, Nelson Mandela had become a glue and the savior and the father and the if you like, the leader for us, even the white population. You know the whole story about black and white and everything about South Africa. But they said to me, Alam, the people who are originally from white backgrounds, they found Nelson Mandela as a glue for them with this country, with the country where they belong. That to me many times we want to tell we belong to South Africa. It doesn't matter about the color of his skin. Who made that possible in our mind is Nelson Mandela. So I think, Dr. Fathia, I'm not exaggerating, but the way I learned in the last 2 days, reading, watching about people talking about you, particularly your students and your doctors, the way they talk about you, they talk about this, how you manage to glue them around. I know there's a lot of people, fantastic. So Dr. Fathia now in the hospital, she will tell us everything where she is now, and she's going to join us, and I'm really pleased. She's going to actually share her screen from the hospital, from her own laptop. So Dr. Fathia, we are very delighted to have you with us. By the way, all the CVs of all those speakers, all those be shortlisted, and also the judge who gets these awards are all available online, because to talk about everyone is really going to be long. So every speaker, all the judge who gets them, and all the women who have been shortlisted, not only the winners, everything is online. You can read as much about them. So Dr. Fathia, if you can unmute yourself, and the floor is yours, and we're all looking forward to listen to you. We can see you, doctor. We just make sure you can start sharing your screen. We can't hear you, doctor. We can't hear you. We can't hear you. Fantastic. We can see the screen, we can see you, doctor, but we can't hear you. We see. I know it's very difficult, really, and I remind everyone this is direct live from Sudan. But I hope, I know you are a lot of people there to try to help you. But I'm really, really pleased to see everything, to see you, to see the people with at the back of you, with you in the hospital. I think it's still, doctor. Yes, just about.
Hello?
Yes, well done. Go ahead, Dr. Fathia.
Okay. Good afternoon, everybody. And thank you very much, bro. Thank you very much for talking to me about all these fantastic words. And I really appreciate your effort in contacting me. And I thank all people who are sharing the video and appreciate what we are doing here in Umdurman. There are many people doing the same job and maybe more in my hospital, and they are here before I came. Just and I will go through my slides, and I named this presentation as Saving Life of Children in War in Sudan, Khartoum State, and especially in Umdurman. I think just and I will talk about Khartoum State. It's composed of Khartoum North, and Umdurman. Khartoum North, there are very hard area. Umdurman is still, we have very hard time in that, but a little bit better in other 2/3 of the states. So majority of patients who are not managed to get outside the country, they are gathering in Omdurman state. So they have plenty of people and overcrowding. Yes, I will give a brief talk about myself. Prof. Alam, he covered the area, but just to remind, I'm Dr. Fathia Elmakki, consultant pediatrician. I'm an associate professor in Ahfad University for Women of Durman, Sudan. This, and to my pleasure, because of this Women Day, the university is only for women, and this started long time and giving great job for teaching girls. I'm the head department of the Pediatrics unit. I'm graduating from the famous University of Khartoum in 1985 and got a degree of MD in Pediatrics and Child Health in 1995. Since then, I'm working as a pediatrician and going many places. And I'm involved actually in the teaching, training, and examination of medical students in different universities, as well as educating and teaching the registrars and those who are having higher study and participating in their exam for fulfilling their MD in pediatrics. I'm married and I have one son who is now a medical student in the final year, and I hope for him the best in his life. Just I will give you an idea. Before the war, and I have been working in me, I have been working in a hospital named Mohammed Elamin Hamid Pediatric Hospitals, together with my university commitment. When the war started and the crisis started on 15th of April 2023, actually, I was stuck in my home because I'm living near military area. We did not manage to get out from that area, but thank God later we succeeded to move from that dangerous area to a better area, which is the north of Omdurman. And I'm happy I come here to Omdurman because here really uh, I joined Buluk to my pleasure. When I joined the Buluk, مستشفى البولوك Hospital is a pediatric specialized hospital in Omdurman, and it have it's a big hospital, but it is not the hospital in Omdurman. There are many hospitals, but now in the war, it is the only hospital working in Omdurman and actually in Khartoum states. I have the honor to join this hospital uh, to work as a senior consultant since I joined, and I work with a tremendous team of the hospital who are working there actually from the beginning of the war. And when I came and I found them, there is a very big team composed of house officers, medical officers, and registrar and consultant, and other junior staff. Since I joined there, I'm working as a senior consultant, as I said, and I'm covering a unit. I'm doing the rounds. We have many wards, plenty of wards, and covering outpatients clinics. Actually, the wards here were plenty and overcrowded. Sometimes you don't know where to put these patients because all patients are coming here. They're receiving patients from everywhere. People are doing a very great job actually here in this country, and I really thank the junior staff, the resident doctors, the registrars who are having the majority of the work they are doing. The other thing that is, I'm involved in the training and teaching registrars, house officers, and other junior staff. I'm involved also in the teaching of medical students. I'm covering also outpatients clinic in the hospital. We are doing around, we are coming, and we have other commitment for the hospital. You know, I think if there is war, there will be plenty of problems, some matter arising other than your work. There are certain things you have to cover. During the war, people are not working. They have no money, so the administration here in the hospital, they are doing a great job with the help of friends and other donors from other area to just solve the problems. Buluk Hospital actually was the only hospital which continued to work and give services from the beginning of the war, and it served the whole Khartoum state, as I said, together with those people displaced from other area, including Khartoum states or other states also that are coming. Also, we receive patients and cases referred from other states. The staff and the working group in the hospital composed of consultants, of registrars and medical officers, house officers, and other medical personnel. The majority of people here, there are not the original staff, there are helper and volunteer coming from different areas that is having they are here or they are coming from other area and they join this only working hospital to help in managing pediatrics cases. During this war, the people actually are working hard to improve the situation so as to give a better care, management, and services for the patient in spite of the poor resources we are having. We face with a lot of problems. For example, the lab before the lab, plenty of hospital here on Dermat, but the lab will not include all these rush of patients and this huge number of patients coming to the hospital. So we have problems with investigations, and the hospital is lacking some resources for the investigation. Medication, for example, also are suffering for that because they have to buy it. The Minister of Health help a lot bringing these things, like still they are lagging behind because all people are here and we don't have area to refer cases for further investigation or management. In spite of this, even if we want to send them to other area like Sudan or Adbar or whatever, we will, there's difficulty in that because the transport during the war, there is a real problem and there are some areas where there is some obstruction, you cannot go across that area. For people running to solve all these problems, we have other problems with the transport or the
I'm not sure, but I think
medical personnel and people working in the hospital area from a long distance. But this is a real problem. This is overcome with the help of other areas. The majority of problems and difficulty were overcome. Actually, still we are having need something like we overcome the majority because of the excellent harmony between the members of the staff and the unlimited help from Khartoum State government, from Ministry of Health, from
I think we appreciate really joining us, Dr. Fathia, but I think definitely there is a problem, and we know what
donors and friends, actually, and I really think are work in harmony, and you don't know who is the doctor, who is
Dr. Fathia, maybe if you close the camera, maybe it will help you to improve the signal. Maybe you close the camera. Okay, I think we lost her. I think they're doing really fantastic work there. Dr. Fathia, can
Hello?
you? Yes, I think what I'm suggesting, if you want to try to wrap up quickly, but at the same time, maybe you close the video and just give a concluding remark. I mean, because the video sometimes will get you losing some signal strength.
Okay. أنا also almost I'm finishing.
خلاص واصلي we are listening to you.
Okay. يلا أعملها فول سكرين عشان يشوفوها. فول. هاي. قفلت عليه.
Take your time يا Prophet Director.
عملها فور كده رجعت. ولا هنا فول سكرين. ما في يا الله مش همشي. لا. Hello.
Yes, we're hearing you.
Okay. Just we have some problem with يعني manage some but other we fail. Okay. We have يعني we improve in so many things during the war. And before we have some area were not covered in the hospital. During the war, we managed to make new services added to the hospital, like different subspecialty clinics, like endocrinology, cardiology, neurology, psychiatry, especially because many children actually they are coming with some psychological impact. There is also improvement in the lab. There is some addition of more tests and investigations. We manage to have to make an HDU, high dependency unit, and neonatal intensive care unit. Before these are not available, alhamdulillah, we adopt these two. There is a building was arranged for an ICU and a pediatric surgery theater, but till now, unfortunately, we did not manage to got the equipment and the instrument and prepare it for surgery and accepting cases in the ICU. We are hoping soon we can manage for that. This is the end of my slides. To summarize, is that with the hard work and with the harmony in the group and with the help of the friends and donors, we did a lot actually, even in the hospital area with included so many things, and we face with patients with many difficulties, with many complications. We tried our best to solve these problems. While those who cannot manage, we will try to send them to another town if there is the resources is there. People suffering, but they are happy. They are giving this effort to pediatrics. This is the end of my slides. I thank you very much. I thank all the listeners. I thank Prof. Alam who gave me this chance to talk in this day, and I congratulate all ladies, and hopefully every time we will, girls and ladies will improve and they will have a better chance and a better world than I have. We will, next year, I hope there will be no war in the world and there is no killing of children or kidnapping of female or whoever. Thank you very much. Thank you very much and have a nice day.
Thank you very, very much, Dr. Fathia. We are very, very grateful, really, for you to make all this effort just to come to us here. We can understand how difficult. The two questions out of many questions we had received, and I think they are very burning questions. The first one, Dr. Fathia, when this war erupted in Sudan 3 years ago, everyone was fleeing the country. Millions of Sudanese, which is the largest in the whole world now, of the people who displaced outside the country and inside the country. So everyone was leaving the country. They went to Ethiopia, to Kenya, Uganda, Egypt, and rest went to Saudi Arabia, Qatar, Emirates, and so on. Those left in Sudan, like in Khartoum, where the war, the killing, the raping, particularly women. I remember I talking to women, they said to me, I have to leave with my daughter because these people, they're after women. They want to rape women. Really, one of the things, I have heard this by my own ears. Why, what was in your mind staying in Khartoum, in that war zone? Everyone was leaving, either outside or leaving to other cities like Medani and so on. What was in your mind? That's the question we really want to break it here as a news. Why did you stay? What was in your mind? Not as a doctor, as a human being, as a lady, as a woman, as a person. Why did you stay?
Okay, I will answer this question. In the beginning, actually, we don't think that this war will continue. No, we thought it is only, and I remember that day we are preparing for things for Eid al-Fitr. We think it will be only 2 or 3 days. It will not be more than that. For some people, they are saying by the end of this day, everything will finish. Yani we never thought it will continue. Till now, we're hoping that will stop. Like, and unfortunately, it is increasing and extending and involve the whole country, unfortunately. But this is one of the things. The other thing is that I don't want to leave my family. The extended family, you know Sudan, you have the extended families. We are talking together and arranging. And I have my brother, my uncles, and my aunt, all of them, they say they will not move. And this is this. If we will die here, we will die any other place. But really, I don't want to separate from my family. Another thing that is my son is a medical student, and in the beginning of the war, we don't know what is going on. He will, where I will go, he's final. I don't see much. There is no country will accept the final student, and I don't want to move. He himself, he don't want to move from his colleagues. But there are plenty of things. Like the major thing is the family side. I don't want to go away from my family, really. And even if I came here to Karari area, north of Umdurman, and I'm living now with my sister. All of us together, me and the rest of my brothers, we are staying in my sister's home. My brother, alhamdulillah, the area is now free of crisis here in Umdurman, and they went, but I'm staying here because I'm living near Mohandisin, and that area is still, there are crises and there are problems, so I cannot go now. I'm really, I will tell you, I'm happy. I'm happy I did not.
That's my second question. You're so happy in the videos, and we can see the passion and you give people power and energy by just looking at the way you're so resilient. Even in your presentation now, I know that you're in the hospital with lots of people with you, but you're so confident. You're so inspiring everyone here. And I can tell you, when you finish, you can go and read the videos. When you see, there's a lot of comment. I will just read you a lot of them. Thank you. We're very proud of you. Hands up for you. Even this hand up is from Suhair.
Okay.
Overseas.
Just one word, Prof.
Yes?
Just and I'm happy. I came and I'm happy with my. I can say my. they will tell me Mama Fathia, and I really like them.
ممكن نشوفهم. Can we see?
أيوة.
Can you just tell the camera right and left? One by one, can you just introduce yourself? We can see on your right hand side, but definitely, as I promise. MashaAllah, wallahi, well done. We are very, wallahi, everyone is very proud of what you have done. You can come to the screen, yes, to the screen.
Okay. فهم دار البلانتي طبعا ودار قدري قالوا مين هو
the question, I can see it in the media. From where did you or do you get that energy? The car needs fuel in the morning in order to go to the next step. Where do you get that energy? Where you get that? I know you said you love to stay with your family, you will live and die there. This is all fantastic. But the way you were living through these 3 years and still giving energy to these people with you, and they call you Mama Fathia, you said, where do you get that energy? Because we need to learn from you so that when we have our lowest period, we can actually uplift ourselves. Where do you get that? From where?
والله والله I don't know. I think this is from God definitely. This is from God. يعني في things that this أنا يعني nothing will happen to you other than what is يعني God decided for you. يعني for this what give me this energy. And I said what will happen to me, it will happen. And I'm doing my best. I'm doing my best. So inshallah, God will help me and will not leave me. This is what is the message. You need to work. I don't stay and say things will happen like this. Anyhow, this is what happened, and I'm happy I'm here, wallahi. I'm very happy.
Thank you very much, Dr. Fathia, and all the team with you, the boys, the girls, we can see them there. And we definitely have to come do a much more better look at the hospital. But thank you so much. And please, it's being recorded. We will share this video with all international doctors, unions, every place we can share, because this is a true story. It's not about Sudan. It's about really, really remarkable resilience. And this is what we want to hear. Thank you very much. We have to leave you here, but thank you so much. Stay with us, but we will go now. I think it's very good start. Really, I'm very pleased. We've been lucky. I think we've been lucky to have you.
I'm lucky. I'm very lucky.
Thank you very much. Really, I think we all share our appreciation of what you have done.